Hi, welcome back to Nurse Ed Scholar. Um, Now, one of the most dangerous mistakes a nurse can make is assuming that a patient is improving when they are actually getting worse. And in respiratory care, patients don't usually go from, stable to failure like instantly. Um, they kind of follow a pattern. They move from early respiratory distress to respiratory failure. And the NCLEX expects you to recognize, this progression. So in this lesson, I'm going to show you how to identify early warning signs of respiratory compromise, late signs of respiratory failure, and that moment when the patient starts to kind of decline, deteriorate. Because if you can recognize this early, you really can prevent respiratory arrest and actually save your patient's life. Okay, and that's the main goal of what we're trying to accomplish with this respiratory series. So, okay, let's look at progression. Respiratory deterioration follows kind of like I said, a predictable pattern. And understanding this, is key to, answering your NCLEX questions, right? And the progression kind of looks like this. It's simple. It goes from early distress, then the patient compensates. And compensation is the body's gonna try to do something to get whatever, the oxygenation in, the CO2 out. It's gonna do something, and that's that compensation that the body goes through. And then if it compensates for too long, it's gonna get tired. And then, just like anything, when you talk about a rubber band, okay, let's just say that, and you just keep stretching it and stretching it, and then it's just not going to bounce back. It's going to begin to fail, and that's where we are. We need to know early distress. We need to recognize compensation, and then understand if you don't fix the problem, the patient's going to fatigue, and then they're going to fail. They're going to go right into failure. And each stage has different signs. And your role as the nurse is to really identify where that patient is along this progression. And a lot of students miss questions because they focus on the symptoms instead of recognizing the trend. You will hear me talk about this all the time. You have to recognize trends. You don't look at isolated numbers, you look at the trend of the patient's status. All right. What are the early signs, of respiratory distress, right? They're important because if you recognize them, and you jump on them, you can intervene early and actually prevent your patient from declining. And, realize that when you see these early signs, the patient is starting to compensate. Okay, so they're in distress. And if they're still, more or less talking to you, their body is trying to compensate to fix the problem. And what you're going to see is tachypnea. Their respiratory rate is going to increase. They're going to be restless, they're going to be anxious, they're going to probably even be agitated. You're going to see that they're really working hard to breathe. They may even be using accessory muscles. They're, nasal flaring. So these early signs. Um, Patients will also, like I said, they'll be anxious. So they'll have that anxiety. They'll have that anxiousness. They'll just seem uncomfortable. Like, um, we talked about working hard to breathe. It's like they're trying to just grab the air and bring it inside of them, and all of this is really, like we said before, they're starting to compensate. They're really trying to increase the oxygen being delivered inside the body. And like I said, at this point, I mean, they're working, they're trying to compensate for that loss of oxygen. And, if you think about that progression to deterioration, they're compensating. But if we don't jump in and correct it, the patient is going to start fatiguing. And, you know, a lot of times when a person is in distress early, the students and some beginning nurses feel like, well, the patient is still okay. They underestimate the distress because they're still awake. They're still talking to you. They're still alert, but you got to look at those signs. They're just not right. You have to realize that something is really just wrong with my patient. They feel uncomfortable. They look like they're breathing a little harder. They're talking to me, but something's just not right. And you have to recognize those signs and intervene early. The next step on, the progression is fatigue. We talked about it. If you do something long enough, you're going to get tired. And like I said, if that underlying problem isn't corrected, that's where that fatigue's going to come in. Signs would be, they were breathing, they had that tachypnea. They was breathing fast. And now their respiratory rate is decreasing. They're going to start they're going to start, breathing. They're going to have that shallow breathing. Reduced effort. You're going to start noticing they were talking before. Now they're going to have difficulty speaking, and they may start getting a little confused because that oxygen delivery is not there like it used to be. And, so you're going to have to really kind of recognize those signs and recognize that, man, my patient is starting to fatigue. Now, hopefully, your patient doesn't get here because you should have recognized those early signs of distress. And this is where it becomes really dangerous. Remember, they were having distress, they started compensating, working harder, and now they're getting tired. And what happens when we get tired? We start getting calmer. We don't appear as anxious. We're quieter. And the problem really is, and the most important thing is that the patient is starting to become exhausted. And we have to recognize that this fatigue and this exhaustion in our patient is not a good sign. And that is what students and new nurses miss. And when your patient kind of progresses into that, late respiratory failure, the patient, I mean, they've already fatigued, right? And they can't maintain oxygenation or ventilation. And this goes into respiratory failure. And at this point, you're going to have uh, a slow respiratory rate, bradypnea. They're going to start having cyanosis, maybe a little blue, I guess a bluish tint to the lips. Decreased level of consciousness is not oxygenating, or like we said, not ventilating. So now they're retaining that CO2. Won't be able to maintain their airway, minimal respiratory effort. And at this point, our patients are going to be drowsy, confused, maybe even unresponsive. And you have to recognize that this is a medical emergency. Call that rapid response. Now, the NCLEX really wants you to know, you know, that you can recognize that your patient is actually worsening and not improving. Like I said, you know, students often choose, a patient who is anxious, who is tachypnic, who is distressed. But in actuality, the patient that's really in the most distress and at a particular dangerous point is the one who has become quiet. The one who looks fatigued. They look tired. They look like they're about to give up. They're drowsy because the patient is getting closer and closer to respiratory failure. Now, let's look at, in NCLEX scenario, right? So you have a patient that's taking care of two patients and one patient, okay, their respiratory rate is 30. They're restless. They're anxious. They're using those accessory muscles. Now remember, that patient is the one who is compensating. Okay. Now she has another patient whose respiratory rate is 10. They're starting to breathe shallow. They're drowsy. They're becoming difficult to arouse. Now, that is your patient that is going toward that fatigue and failure. So that is the patient that is the most concerning. Even though the patient A is anxious and they seem distressed, patient B is the one who is I guess, demonstrating or showing or exhibiting that respiratory fatigue. That decreased level of conscious, big clue. Hypoventilation. So we learned about hypoventilation where they're retaining that CO2. Um, and that's showing you that's late respiratory depression and deterioration. And so this is really what we want, students and nurses to recognize. So when you make your decisions, and I know I've said this before, but this really helps with trying to determine what to do. First, when you're seeing a respiratory question on your testing or on the NCLEX, or even when you start practicing, the first thing is that, I have a patient with a respiratory condition. Are they compensating? Are they showing tachypnea? Are they anxious? Do they have an increased effort of breathing? Because that's going to let you know, hey, they're compensating. Then you want to say, does my patient look fatigued? They have this respiratory condition, they were working, and now their respirations are slower. Shallow breathing. Start to get a little confused, right? And then your third question for your respiratory patient is, okay, is this patient starting to fail? You know, do they have a decreased level of consciousness? Are they starting to fatigue? Minimal respiratory effort? Are they showing that cyanosis? You have to understand that the NCLEX uh, rewards students who can notice and worsening trends. I'm going to always say trends. You have to, and that's why it's so important when you go in and you have your patient, regardless of what the patient, what the diagnosis is. When we're talking about respiratory, right? You go in first thing after you get report, you go and look at your patient. You're looking to see what they're, how, are they talking to you? Are they awake? Are they oriented? You're listening to a report, and you see that first. You can't wait after report and then go into a patient's room at 11 o'clock. You need to go in initially, do your assessment real quick, because if your patient starts to deteriorate during the shift, you will be able to see that deterioration. If you never go into that patient's room, you're not going to know. And see, when the provider come in and say, well, how were they when you came in? And you're like, oh, I just went in there. That doesn't look good. Okay. So I just wanted to throw that in because that is so important to assess your patients as soon as you get to work. Now, some takeaways. Yeah, early signs, like I said, compensation. Your patient has a respiratory condition, and then you start seeing that they're working harder. They're working harder, right? That's early signs. Late signs, especially a change in their level of consciousness, they're starting to look fatigued, that's starting to go towards that fatigue and failure. So you have to really recognize those things because you have to remember the most dangerous patient that you have is the one who stops fighting. I mean, looking at the trends of that patient, they look the worst. You can't assume, or they're just resting now, because that's not what's happening. Because if you have any fight left and you're not breathing, you're going to continue to fight. But if they're fighting and then they start to get calm, it could be that they are fatiguing out. They stop fighting, and you do not want that on your shift. So I hope this lesson was uh, valuable to you. I hope you understood, the importance of really, looking at your patient, your respiratory patient, and looking at the trends and being able to notice the signs of deterioration. I hope it made it a little bit clearer, with studying and even in practice. And so if so, please like this video, please subscribe to Nurse Ed Scholar. This series and all of my series, is really to help you think through clinical situations, the way the NCLEX expects you to. And if you like some more structure or something, I've created some workbooks on NurseEdScholar.com that kind of helps reiterate a lot of the things that these videos have. But please come back, if you're studying or you're getting ready for your finals or you're getting ready for your for the NCLEX, come back because these videos will help you along your way. So in the next lesson is my last video for every series is, it's going to be respiratory NCLEX case scenarios to bring everything together. And, I try to do that last video to kind of put together everything you've learned. And so, um, I'll see you in the next lesson and happy studying from Nurse Ed Scholar.